Hey everybody, talking about abdominal pain, talking about nausea, talking about constipation, diarrhea, these common symptoms seen with digestive illness and what could actually be going on here. I'm Dr. Diane, your chronic illness expert, leading you and helping you understand root causes of disease. So even if you've done the standard workup, even if you've done stool cultures and colonoscopies and endoscopies and CAT scans of your abdomen and more, even if you've done all that and either had maybe one of two things happen, right? Either have doctors tell you like, well, we don't know the cause of this, and you just get an IBS label, or even getting a diagnosis for something such as ulcerative colitis or a different form of colitis or Crohn's or gastric emptying syndrome or something else, right? Even if you have this diagnosis, it still is not telling us why. I think it's one of the things that people really need to start understanding is the body is not just like wake up one day and say, hey, I'm going to manifest disease, right? There is predisposing situations through exposures in our environment, through stress, through lifestyle factors, and more. Yeah, genetics play a role, but genetics just don't wake up and express disease. Genes have to be activated in order to do so. So we really need to start saying why. Even when we get a diagnosis, we really need to start saying, well, why did my body start the process that led to this disease? Now, we do want to rule out all the common things, right? In medicine, we have this saying of if you hear hooves, think horses, not zebras. And what that essentially means is like, don't get so excited about the new thing you've heard that you don't think about like the basics, right? So we want to always think about the basics. Are you eating clean food? Are you drinking good water? Have you looked for parasites in your intestinal tract? Have you considered the fact that not all parasites are found on lab tests and could still be hidden in your intestinal tract? Have you considered things such as fungal overgrowth, small intestinal bacteria overgrowth, even basic things such as a lack of stomach acid or pancreatic enzymes? So those are the hooves, right? Those are the obvious things. Now, some of the zebras, one of the most important zebras I find is mold. And so I've seen clinically, I've seen in research as well. I'm going to put a study in here also for you to review on this topic that really is looking and saying mycotoxins, the toxins from mold, can actually cause nausea, right? They can cause abdominal problems. And I've seen both clinically as well as in research, people that are in moldy homes that are having digestive problems that leave their moldy homes and all of a sudden their digestive problems go away. And we know this is impacting them because the moment they go back into something, a home or office that's moldy, guess what? Their symptoms come back. So I really want everybody to begin to think about, hey, if you have a diagnosis, this is in many ways, the beginning point of the discovery process. We got to get away from this thing in medicine where we get the diagnosis and then it's like, oh, poof, we're done. Here's the medication, go away. That's not helping anybody. It might make you feel maybe a little bit better, but whatever those disease processes are still going on beneath the surface. So even if we give you a palliative thing, if you're experiencing something like pain or nausea and we give you something palliative to make the nausea go away, make the pain go away, that's nice, right? It helps you enjoy life. It helps you get your tasks done of the day. So sometimes palliative treatment can have a purpose, but the point and the problem is when we make that our end goal, right? When we're saying, oh, okay, I don't experience a symptom, so I'm fine. Well, whatever process is happening in the body is happening still beneath the surface. So when that happens, it's still creating inflammation and many times systemic inflammation and imbalances in widespread areas of the body. So what winds up happening is because you haven't stopped that disease process, but you just put a Band-Aid on the symptoms, then other types of dysfunction are happening in the body. And you may wake up one day with a different sort of problem that actually may be related to that fundamental root cause. So that's what I really hope everybody is thinking when it comes to figuring out what the heck is going on with their disease process is why? The body does not just wake up and do this for no reason. And if you're working with somebody who's not willing to find and help you find out the why, definitely would recommend doing some soul searching, internet searching, finding somebody that can help you figure out the why. You can always call my office if that would be helpful for you in any way. There's information about our work in the show notes for you. And I do hope this helps you a lot. Please do share this with any friends or family that you think could benefit from this information, because it's really important that we get this out and working to help less people have chronic disease, ending the chronic disease epidemic, and really understanding what the dysfunction is to get people well. All right, everybody, I hope you do subscribe. I'll see you in another video.